Hello, everyone, and welcome to a series of lectures on diabetes awareness titled Understanding Diabetes. My name is Desmond Croker, registered nurse and Caribbean certified diabetes educator. This series comes to you with compliments of Annie's Memorial Chronic Disease Education Center. In this series, we will be seeking to enhance your understanding of diabetes in an effort to equip you with the skills needed to 1. Better manage diabetes if you already have it, prevent or delay the onset of diabetes if you don't have it, especially if you are at risk, and 3. Prevent or delay complications associated with diabetes if you already have it. Examples of topics that we hope to cover in this series include Type 1 diabetes. What is it? Type 2 diabetes. What's the difference? Risk factors for type 2 diabetes. Are you at risk? Gestational diabetes. What is that? Diabetes emergencies. How to handle them. Diabetes and your eyes. Why is your vision blurred? These are just a few of the topics that we're hoping to cover. Today we'll start off with a general overview of diabetes. What is diabetes? Diabetes results when your body is unable to process the sugar from your meals and convert it to energy. Because of this, sugar remains in your blood longer than it should, leading to what is termed hyperglycemia or high blood sugar. When we eat our food, the carbohydrates in the food turn to sugar. The sugar must then enter our cells and be used to create energy for us to go about our daily activities. Our pancreas, which is an organ in our body, produces a hormone called insulin, which facilitates the movement of sugar from our blood into our cells. While there are many types of diabetic disorders, there are 3 main types that are most common. Type 1, which make up about 5 to 10% of the diabetes population, is an autoimmune disorder where the body's own defense system attacks the cells in the pancreas that produces insulin, killing almost and sometimes all these cells and making it impossible for the pancreas to be able to produce insulin. This results in the buildup of sugar in the bloodstream because at this time the sugar is unable to get into the cells to make energy. Then we have type 2. Type 2 diabetes is the most common type of diabetes. This makes up between 90 to 95% of the diabetes population. This type of diabetes is what we call insidious degenerative disorder, meaning that it develops over a long period of time and it basically creeps up on you. With this type of diabetes, the pancreas is for some reason either unable to produce enough insulin or the insulin being produced is unable to function as it should. This again results in high blood sugar in the bloodstream. Gestational diabetes is the third type of common types of diabetic disorder. This type of diabetes is only featured when in pregnancy. This is where there are high levels of blood sugar only during pregnancy. This type of diabetic disorder would generally go away after the pregnancy has been completed. Women with gestational diabetes usually are at risk for type 2 diabetes and later in life, and therefore should put all measures in place to prevent this from occurring. Diabetes management would vary based on the type of diabetes you have and your personal socio-economic situation. However, the aim of diabetes management is usually to achieve and maintain normal blood sugar levels in your body, and to prevent and delay the onset of complications associated with sustained high sugar levels. Generally speaking, these would include taking your medication correctly and making lifestyle changes like your diet and exercise. We will look deeper at these measures in subsequent episodes. So, until we meet again, stay safe and remember that healthy lifestyles begin with a choice.